I'm Siobhan. I'm going to be your practical nurse for today. I'm just going to be giving you a head-to-toe assessment. Is that okay?
Yeah.
Okay, I've already performed hand hygiene, and I'm just going to check your wristband, okay? Okay, perfect. And do you need to go to the washroom before we start?
No.
Okay, and you're comfortable?
Yes.
And privacy's already done. The door is closed, blinds are closed, curtain would be closed. There's no curtain though. Okay, I'm just going to start off by asking you some health history questions, pretty basic stuff. So I'm just going to ask for your age.
18.
Okay. And masculine or feminine?
Female.
Okay. And do you have any long-term health problems in the past with you or your family, like heart disease, lung disease?
No.
High blood pressure, diabetes?
No.
No? Okay. Do you smoke?
No.
Okay. Do you do drugs?
No.
Okay. Have you had history of asthma?
No.
Okay. And I'm just going to ask if you're orientated. So I'm just going to ask you, who am I?
A nurse. Practical nurse.
Yes. And do you know where you are?
Yes. At the hospital.
Yes. Okay. And do you know the time? About what the time is?
4.
Perfect. Okay. And then I'm just going to start by doing some vital signs, just so I know your baseline for everything.
Okay.
Vital signs. So I've gathered everything I need for today's entire assessment. So everything's behind me and sanitized. And do you have a baseline?
Yeah, like 130-ish over 90 or so.
Okay, good. And is it normally around there or does it fluctuate?
It's about the same.
About the same? Okay. So I'm just going to check your blood pressure, make sure it's on the diaphragm. Okay. Okay. So for your blood pressure, I got about 126 over 85. Is that normal to you?
Yeah.
Perfect. Okay, now I'm just going to be checking your pulse. Okay, I got 64. I'm just going to document everything. I'm going to count your while I'm counting your respirations, I'm actually going to take your temperature as well under your arm, okay?
Okay.
So just breathe how you normally would. Close that nice and tight. I'm just going to count your respirations. Okay. 16. That's normal. So far, all findings have been effective. And hopefully this will go off in a sec. 36 degrees. That's normal for an auxiliary temperature. Good. I'm going to document again. So everything's been normal. Now I'm going to do a neuro check, okay? A few neuro tests. So I'm going to check your eyes and making sure they're round and reactive to light. Good. So they constrict, which is what we're looking for. And I'm just gonna ask you to stick your tongue out now. Okay. Now I'm just gonna ask you to do a finger to nose test, so just kind of like this, back and forth. Keep on going. Good, and now we're just gonna touch an object to your face and you're gonna tell me how it feels, so sharp or dull or painful. Okay, so ready? Just close your eyes and you're gonna tell me how it feels and where I'm putting it on your face, okay?
Soft forehead.
Okay.
Soft and near my eye. Soft on my cheek.
Okay. And it was a very gentle sort of feeling? Okay, so I'm just gonna test your gait now so you can walk back and forth normally as you would. And I'm just gonna try and see any abnormalities. Okay, and now you're just gonna face me and do the same thing, walking forwards and backwards like you just did, with your heel to toe though instead. So you're gonna do it normally, and then the second time you're gonna close your eyes and do it. Okay, that's good. Okay, now one more time with the eyes closed. Now you're gonna do the tandem walking heel to toe with your eyes closed. Okay, good. Now I'm just gonna do the Romberg test, which tests your coordination and your balance. So just close your eyes and try and stay in the same spot. Good, that's effective. And now we're just gonna do your head and face. So I'm gonna look for symmetry and document, and I'm gonna look for regular distribution of the hair, the color. I'm gonna make sure you have a regular skin tone. I'm gonna check for your ear alignment, make sure they're nice and even. Turn your head. Good, that's effective. I'm gonna look at your conjunctiva, make sure it's nice and white, make sure your sclera is pink. Good. I'm gonna check for septum deviation, so I'm just gonna put your head up a little bit. Good. Okay, now I'm just gonna feel your sinuses and make sure you're not having any pain. Do you feel stuffed up or anything?
No.
Okay, now your frontal, maxillary, good. Okay. And now I'm just gonna ask you to put one finger on your nostril and then breathe normally. Okay, now same thing with the other side. Good. Okay, and now I'm just gonna do a whisper test. So I'm gonna whisper you two things in each side of the ear and you're gonna try and tell me what I said back to you, okay?
Mm-hmm. Apple peanut butter.
Good, now other side.
Monkey Mackenzie.
Yes, okay, so that's good. Now I'm just gonna check your neck pulses, so your carotid. Okay, I'm gonna count it. Okay, 62. Gonna document that. I'm gonna go on the other side now. Okay. Gonna count that one as well. Okay, 64, so they're pretty even on both sides. They were strong and regular. Okay, so if you want, just open your mouth and I'm just gonna see if it's moist. Lift your tongue up. Good. I'm actually gonna shine a light in there. That's okay. Tongue down. so everything's effective. It's nice and moist and nice and clean teeth, and her tonsils aren't swollen or anything. And I'm just gonna make sure your trachea is aligned with the center of your body. Good. Your thyroid gland is palpable, and I'm gonna move it from side to side, checking for any swelling or tenderness. Does this hurt?
No.
Okay, and there's no swelling and it moves easily from side to side. There's no hard masses, so that's good. I'm gonna check your skin trigger right by your clavicle, so I'm just gonna give you a little pinch. And it bounced straight back, so that's great. And I'm gonna listen to your thyroid just to check for any groovies. So just breathe nice, deep in and out breaths for me. Good, again. So far they sound nice and clear, which is what we want. Good. And the skin's nice and in tone with the rest of her body, which is great. And everything's effective. A lung assessment, I'm gonna just make sure everything's all even for her chest expansion. So just take a deep breath in and out. And I'm making sure each side expands equally, which it does. So that's great. I'm gonna look for any chest configurations. There's no like dents in her chest area, no concave dents. I'm going to first just percuss. Making sure not to go over the ribs or anything like that, or else it'll affect the sound. And I'm just looking for resonance. Gonna percuss. Make sure there's no masses or anything. Again, you're just checking between the ribs. And then I'm gonna listen, so just breathe in and out. And I'm going from side to side. Okay, and now I'm just going to make sure our patient's heart sounds, making sure S1 and S2 sound nice and clear. And I'm just making sure there's no masses by the heart or anything. No hard masses. Okay, now I'm going to listen. Take a deep breath in. Again. I'm just going to kind of dig up. Okay, go again. One more time. Good. So S1 and S2 sound very clear. Abdominal assessment. I'm just going to start off by looking for any abnormalities, any scars, any lumps or bumps, which we're going to feel for later. Then you're going to auscultate next. In each quadrant, starting by the right lower. Just making sure everything's moving. And you want to listen for at least 15 seconds in each quadrant. And then you're just going to palpate. And you want to hear a nice timpani. And then you're going to do a deeper percussion, really feeling for those lumps, any discomfort or tenderness. Okay, now we're testing her lower half for musculoskeletal. Now I'm just going to inspect for any abnormalities, any deformities, any edema. I'm going to test for it by seeing if there's any pitting in the legs or in the feet. I'm going to feel for warmth, make sure it's not too cold. I say it's a nice temperature. I'm going to feel for her pulse. It's very strong, very regular. I'm going to look for a cap refill. And I'm just going to make sure there's no crepitus, so I'm going to put her in a dorsiflex and just kind of flex the foot up and down and squeeze the calf. Sometimes there can be tightness, like this. Good. And now I would document all my findings if not done, state my findings, all my findings were effective, and then I would perform hand hygiene and walk out unless there's nothing else that the patient needed.